Section 3, Part C. So, exercise prescription basics, and these are really the basics. As I've mentioned previously, we will get into specifics for aerobic and resistance exercise and core stability, flexibility in future chapters. So, this provides the basic framework for developing an exercise prescription. Overarching comment, exercise prescription is a science and an art. So the science aspect is that we will follow certain recommendations that have been determined to be beneficial through the research method. So there are things that are in various documents, government documents, as well as position stands, the things like 150 minutes of moderate activity. They are steeped in science that we know if you do those things, you will improve your health. But it's also an art. So the exercise prescription that somebody develops for me would be different from the exercise prescription that somebody develops for you. It does not make one better than the other. Ideally, it should make it more appropriate for the individual. So there's a lot of different ways of implementing the exercise prescriptions, a lot of different modes and modalities of doing it. And it's not to say that one is necessarily better than another. And that's where the art comes into play. So the practical implications as well. The same basic rules apply to everyone concerning a healthy minimum amount of exercise and activity to be healthy. However, how you accomplish this will vary greatly from person to person, and there's no one way that works for everyone, as well as a lot of things that will come into play as preference. What is the person like? Does the person they're a musician and they would much rather play music than complete exercise? Well, for that individual, it's important that they meet the basic recommendations. However, in their downtime, you don't want exercise to be a huge stressor. They may have other forms of relaxations that are also healthy. For someone like me, right now I like to ride my bicycle, so that is the activity that I prefer. So when I have a chance, I will not go to the weight room and lift weights. I did that in college. I don't do that nearly as much anymore. I will get on the bike and I will ride. And these are the types of things that you need to include in the exercise prescription. What is the person like? What is the person's goals? How do we reach them? Things like that. So, and all of that, we want to, adhere to the science, but then how do we reach those recommendations will vary a lot from person to person. Some basic exercise design principles. We'll deal with this in the resistance exercise section again. Specificity. If you do a bicep exercise, it will help get the biceps stronger. So whatever you do is specific to the type of activity that you've done. If you work on your aerobic fitness, then your aerobic fitness will get better. So if you run or cycle or swim, do those types of activities aerobically, you will become more fit. You're not necessarily going to get your squat is not necessarily going to improve. Overload and progression, just keep in mind the nuanced difference between these. Overload is increased workload to make gains, and overload is what happens in a specific workout. So in a specific workout, we're trying to do a little bit more than what our body is comfortable with, so that we will have a physiologic reaction to that. We will get stronger. Progression looks at overload over time. So over time, what is going to happen? So gradual systematic improvements over time. So we're not looking at simply one workout and making the workout a little bit more difficult than we're used to. We're using kind of a systematic progression or a thought process to improve strength or improve aerobic performance over time. Initial values, the lower the starting point, the greater the gains. This is where absolute and relative improvements become important. If you have an elite athlete, they may see very little gains, but they're at such a high level that even those little gains are pretty darn important and can make the difference between one athlete versus another. However, if you have a sedentary individual, and they start exercising, they may see much bigger improvements because they're starting at such a low level. Individuality, this kind of goes relates to talent. What's your inherent ability? So it accounts for individual differences, but also think about the different people you see when you go to a fitness center. Some people, I was very good at bicep exercises and back exercises. So I guess my posterior core from a back exercise, lat pull down, those sorts of things was good, and my biceps were strong. My bench, on the other hand, was not all that great. So you just look at what are your strengths, what are your weaknesses, and sometimes that's just in the way that you're built. And my bench never got to be anything that was particularly great. It was good, but not particularly great. And I worked pretty hard, and it still didn't become that good. As opposed to other exercises, I was much more proficient at them. Diminishing returns. Once you get closer to a goal, there's less and less change. So you work harder, but you're not really seeing much of an improvement. And reversibility, use it or lose it. So once you stop exercising, you lose some of those or a lot of those gains. The basic elements of an exercise prescription, this is the FIT principle, so frequency, intensity, time or duration, type or mode of activity, and then we also add in a P, and the P is for progression. So you can use that to kind of remember the different components, and we'll talk about those different components as they relate to specific aspects of fitness in future sections. The art and science of exercise prescription, I just mentioned this. Some additional information that this slide has in it. So be creative, flexible, and able to modify the exercise prescription based on the client or patient's goals, behaviors, and responses to exercise. I'll reiterate, use the scientific method, use the scientifically developed principles, and then use an artistic approach to personalize it for the individual. And increase the probability of long-term commitment to physical activity and exercise. So if we all do the same activity, chances are people are not going to adhere to it. If you can engage people into things they think are fun and it meets the exercise recommendation, that is really the ideal that we should be pushing for. I mentioned this in class. I think it's important to kind of keep this in the back of your mind. What are some instances where you give the opposite recommendations to two people? And this kind of goes to the art and science of the exercise recommendations. How do these messages get confusing for the general public? In class, I mentioned that you have an overweight individual trying to lose weight. You will tell that person to eat less food while they are engaging in their exercise program to enhance their weight loss, as opposed to if you have a runner that may not be consuming enough food, and because of that their performance is suffering. For that individual, we'd recommend that they eat more. So both individuals are exercising. For one individual, based on his or her circumstances, we recommend eating less. And then for the other individual, we recommend that they eat more. And that gets confusing to the general public because they're saying, well, that person gets to eat more. Why can't I eat more? And it really depends on their individual circumstances. Some stages of progression. Initial conditioning stage. So this is where people are learning how to move better and just getting the basic foundational aspects of movement or the exercise. To a certain extent, college students will sometimes, skip this stage because they already have a good base level of condition, especially if you move from one activity to another activity. You may already have a good initial conditioning level. The improvement stage is where you're progressing and increasing the weight or increasing the complexity of the movement. And that takes a few, the initial conditioning would generally be 2 to 3 weeks. The improvement stage will be 6 to 12 weeks. And then the maintenance stage, you're just trying to maintain the gains that you have had previously. To keep in mind with these stages of progression, these typically address adults. So they may work for you right now if you're just starting an exercise program. As a college student, I was annoyed by these stages of progression because I would see progression for years because I was growing and maturing, physically maturing. However, if you're a mature adult, then those stages will happen and they'll happen relatively quickly. If you have an adolescent, as long as they're continuing to go through puberty, you'll probably still see some level of improvement. I would also add for the overweight individual, from an aerobic perspective, they will probably see improvements in aerobic performance as long as they continue to lose weight. So because they're moving a lesser mass uh, uh, as they lose weight, that will keep continuing to improve their aerobic performance. So for those individuals, their improvement stage may be extended. Some basics about exercise science as a profession. An exercise science degree and fitness certifications are better predictors of a fitness trainer's knowledge than experience. So you'll see people that you are competing against that are charismatic. They may not have very much experience, or they may have actually plenty of experience, but they don't have very much academic knowledge, and then that they will probably end up doing certain things very well, and that's why they have a following. However, when it comes to individuals of different diverse sets of individuals that are coming in with a variety of different issues and goals and chronic disease or orthopedic issues, the individual that's not been professionally trained, does not have an exercise science degree, will not be able to work with that individual as well. And that's where it provides a nice advantage for you. Currently, there's no universal standard for fitness in the fitness professions. Hopefully, that will change in the future. And that's why it's important that either somebody is providing you with business, so you have some sort of referral network, or you're in a facility where they provide a referral network for you, or you have to create that referral network and get that clientele. So, and that's challenging. That's where you have to learn to sell yourself. But because there's no universal standard, that is kind of the situation. We do not have that for physical therapy. We do not have that for nursing. You cannot sit for a nursing exam. You cannot be a nurse unless you have gone through the academic training and then taken the certification exams or registry exams to reach that credential. In fitness, we don't have that criteria, so you have individuals that have weekend certifications that are charismatic, that are able to develop a following, and they will have an exercise business. Unfortunately, that's just the way that it is, and I don't see that really changing for the foreseeable future. Terminology for the profession: accreditation. We do not have any national accreditation at this point that has any teeth, at least for exercise science. Certification: there's many certifications, but the criteria to take the certification can vary. So some individuals, it's just a weekend course, or it's or a high school degree or something like that. So it's nothing that's really making sure that an individual has a sound foundational level of knowledge beyond being able to pass the test. National boards: you'll see this for medicine. We don't have this for exercise science. We have certification. Now, some certification exams do require an undergraduate or graduate degree to take them, but generally, in the general public, they don't really see the difference or recognize or realize the difference between different types of certifications. State licensure: we do not have a state licensure. I think maybe one or two states may have a licensure for exercise physiologists, but generally we do not have a licensure. Statutory certification: I'll have to look that up. I'm not exactly sure of that. But this is what we got. Because we don't have these standardizations and high-level credentialing, that allows the student to act as an exercise physiologist, personal trainer, while they are still in school. So from that perspective, it's nice. However, when you're looking at getting a job after graduation, it would be nice if there was a differentiation between you who have pursued an exercise science undergraduate degree versus individuals that do not have that credentialing. And as I said, that might change in the future, but it is not that way right now. That's it.